Welcome, everyone. It's a pleasure to have Dr. Michael Salerno here with us today. And of course, he needs no introduction, but as many of you know, he is the chair of the 2022 SCMR Scientific Sessions. He's a professor of medicine and radiology at Stanford University and the section chief at cardiovascular imaging. And he's been in the field of cardiac MRI for several decades and really is one of the luminaries in cardiac MRI. So it's a pleasure to have him here with us for just a few moments today. He has received numerous research grants, has worked on the development of pulse sequences, and also in multimodality imaging. And many of you may not know, but he's actually level 3 trained in all cardiac imaging modalities. And so it's a truly unique perspective that he offers in our field. He's the deputy editor for JACC Cardiovascular Imaging, and he has received tremendous research support over the years from the American Heart Association and the NIH. And with that, it's a pleasure to have you with us today, Dr. Salerno. Congratulations ahead of time on SCMR 2022. I know we are all very excited about it to begin in a few short weeks.
Akhil, thanks very much for the really nice introduction, and thanks for all the work you guys are doing on social media, getting out the word about the meeting.
Absolutely. To start out with, I wanted to get your perspective on some of the sessions that you're most excited about for SCMR. I know it's maybe an unfair question since you had a hand in choosing all of them, but maybe you can give us a sneak peek as to what things that you're truly excited about for this year.
Yeah, no, I'm really excited about a number of things for the meeting. One of our plenaries is about rapid imaging and trying to move to really short protocols and a comparison of different approaches. Will this be real time? Will it be free breathing, self-gated techniques? What will be the role of AI? So that's one I'm particularly excited about from a scientific standpoint. We have one talking about bringing value of MR to different stakeholders, and that includes a keynote speech by Deputy Chipora, who's the president of the ACC. So I think that will be a very exciting session. Additionally, we have a section about the new chest pain guidelines where we invited experts from all the different societies and modalities to really have a discussion about the role of multimodality imaging and evaluation of chest pain. And then this year we have Claudia Prieto has chaired our whole science program. So she put together a really good science program. And I think there'll be a lot of really exciting things going on there.
It's wonderful. It's hard to choose from some of those awesome sessions. The great thing, I guess, about being virtual, the silver lining is you don't have to run from room to room. You can log on to various channels and catch at least portions of many of the talks that might be going on concurrently. So that's going to be exciting.
And with 2 computers, you could probably watch 2 of them concurrently.
That's exactly right. That's exactly right. Especially with social media, you'll be able to keep up to date with everything. It's been a really exciting year in CMR in general, and I think every year we see all the latest science and publications that are hotly discussed at the annual meeting. Are there any topic areas within SCMR that you're excited to hear about when it comes to CMR? Some of the biggest developments in the community in the past year?
Yeah, I think we keep seeing huge developments in the field of artificial intelligence and really spanning from collecting the data all the way through processing the data. And there's been a lot of interesting things there. There's been a lot of new studies looking at new approaches toward quantitative MRI using free breathing approaches and other 3D related approaches. There's a lot of interesting stuff going on in low field MRI. And then again, I think on the clinical science development, a lot of interest with the new guidelines and around areas like INOCA and MINOCA, which are really up and coming topics. So there's a lot of interesting stuff going on.
Yeah, it's definitely going to be exciting. Coming back to AI a little bit, I know it's a buzzword in cardiac imaging, and a lot of people are interested in how it could perhaps improve what we do as imagers. Can you talk a little bit more about where you see AI going in the future when it comes to CMR?
Yeah, no, I think really AI is going to permeate all the different steps of the process, again, from how we design sequences, how we collect the data and run the scanner, to how we do our image reconstructions faster, how we do more rapid post-processing. And a lot of these things were already there. I think the future will really be, where do we do things? Right now, a lot of the things we're doing with AI are things that we're able to do and just do them faster. And I think the real exciting part will be where we're able to leverage AI to do things that we can't really do that well. So improve our ability to make diagnoses, as well as improve our ability to prognosticate. I think there's a lot of really exciting stuff going on in the field.
Definitely, from the whole workflow, from, as you said, image acquisition all the way to diagnosis and prognostication. I think it's a very exciting time to be involved with MRI and cardiac imaging, and seeing what AI looks like now and what things might look like in 10 years will be, I'm sure, very, very different. So it's definitely exciting. And switching gears just a little bit, we have a lot of first-time attendees for SCMR. I remember the first time I went to an SCMR was as a second-year internal medicine resident, and so it was exciting at that time, and it remains exciting through every single conference. What pieces of advice can you give to maybe our junior or early career CMR attendees who are tuning in for the first time this year, and hopefully will make a habit of coming every year?
Yeah, I remember my first meeting was in around 2006 when I was a fellow at Duke, and I had kind of learned about cardiac MR from Chris Kramer when I was in graduate school, actually doing lung imaging, and Chris turned me over to doing cardiac imaging. And I think it's really important early in your career to really take advantage of things like the expertise in the meeting, the pre-conference sessions, the sessions on early career, which are really geared towards networking and helping people build their careers. I think it's important to really find a place where you have a good environment and good mentorship, because it's super important, not only when you're a fellow, but also when you're faculty and early in your career, especially.
Absolutely. I mean, as someone who is still in my early career and having attended SCMR a few times now, it really feels like a family. And I think being able to connect with someone as prominent as you and some of your mentors and other luminaries in the field, I think can happen at SCMR, where it's more challenging at some of the larger meetings. And so I echo that for sure. And then lastly, we have a lot of people who want to become more involved with SCMR, from those who are early in their career to those perhaps that are more experienced, those in private practice, and those who might be in academic worlds. Any pieces of advice about how to get involved in SCMR? Maybe you can tell us about how you first got started with SCMR, and what advice you would give to people to get more involved.
Yeah, I think that's great. So one is having the opportunities of talking to some senior people or your mentors that may be plugged in SCMR. That's certainly a way. Being involved in early career sessions and networking with other people. A lot of those sessions, we try to have more senior people in the field, which creates an opportunity for people to meet other people in the field. Our kind of speed dating of mentor-mentee type sessions are excellent. I catch back up with people that have been my mentees by that almost every year when we're at SCMR, and it's a good point of contact. And then there's opportunities to volunteer. Like there was just a call recently to be involved in committees, and SCMR is making an effort on a number of fronts to try to really make sure that early career people are involved in the field, because it's really the future of the field. So just ask people if you're interested in getting involved, and we'll do what we can do to get people involved.
And speaking from experience, if you apply for committee, you don't get in the first time, there's tons of other opportunities. So pay attention to the listservs that you might be part of, the calls for volunteers, and there's definitely going to be a need and interest from SCMR and many of the initiatives from the society to get people involved. And with that, maybe I'll ask you any closing remarks. I know we're just a few days away from the beginning of the conference, and we're all really excited.
Yeah, no, I think it's going to be a great meeting with a lot of good educational content. We're all a little bit bummed that we're not meeting in person, but we'll make the best of the situation and really enjoy each other and enjoy the great science. So I really look forward to the meeting, and I really thank you for inviting me to talk about it today.
Absolutely. Thank you so much. And again, congratulations on, I know what will promise to be a phenomenal meeting, and we look forward to celebrating you and the successes, hopefully in person at next year's meeting.
Excellent. Thanks so much. I really appreciate it.
Thank you so much, Dr. Salerno. Have a great day.
Okay. You too.